I'm excited to bring in our first healthcare provider to the program, St. Luke's Healthcare System. If you are obsessed with cleanliness, have a strong stomach, and have good hand-eye coordination, you might be cut out for work as a surgical technician or working in instrument sterilization. Both positions play a critical role in preventing infection by sterilizing, processing, and prepping the operating rooms or ORs. Let's get a look inside these two career pathways, and then we'll hear from the professionals themselves.
Welcome to St. Luke's, a health system with 16 hospitals and campuses and more than 200 specialty and primary care practices. Today, we're taking you behind the scenes and we'll show you a couple of unique career opportunities in healthcare. We'll even get the chance to hear from a couple of St. Luke's team members. So, do you know how many people it takes to operate a system like St. Luke's? Impressive, isn't it? And it's not all nurses and doctors. From surgical support to cafeteria staff to housekeeping, security, and lab technicians, there are rewarding opportunities for everyone. Join me today as we meet two hardworking team members. Our first stop is a place where germs stand no chance, sterile processing. Let's go meet Bree. Hi, Brianna. Hey, we're here to learn all about what it is that you do for St. Luke's. Can you tell me a little bit about your job?
Well, I'm a sterile processing tech here at St. Luke's in the OR. Sterile processing techs, we get all the dirty instruments from surgery. So we can't be like going back and forth. Everything goes one way. So dirty, clean, storage. We get to clean them, disassemble them, inspect them, make sure nothing got broken, and we sterilize them for the next surgeries. We are in decontamination area, whatever you want to call it. So we've got several stations. We've got sink 1, station 2, and then we've got another couple sink stations over there in the corner. And this is the ultrasonic machine. It's pretty cool.
So looking around this room, there's so many different types of tools. I imagine you learn about all the different types of surgery.
Yes, it's constantly learning new things, constantly getting new updated instruments in. It's a lot. Sharp rakes or Volkmann rake retractors, sternal saw, Kelly's, lots of needle holders, and a lot of scissors, of course. Some of them are really, really tiny and cute.
So why did you choose this career?
I knew I wanted to go into healthcare and I knew I wanted to help people, but I wasn't sure that I wanted that one-on-one patient contact all the time. So this was a great option for me to just get my foot in the door, get into the hospital setting and, really figure out what I want to do.
So what kind of certification did you have to get to where you are today?
So you do have to be certified, sterile processing tech certification. You can do it a couple different ways. You can do a course through like a community college, or a really popular option is if you're already working or you get hired on but not certified yet, you can get 400 work hours and then you're eligible to take the test.
So with all the different tools in this huge room, how do you keep track of everything?
Everything is organized by specialty. Every set has a tag on it and we scan it. And a count sheet comes up on our computer, and that's the way we make sure every single thing on that count sheet is in our sets.
Well, Brianna, thanks so much for showing us around here.
Yeah, no problem.
Now let's go meet one of these experts who takes care of these tools before they get to Bree. Let's go meet Angela.
Most of our instrument trays are about 25 pounds. So you get a workout.
Okay, and now what is a surgical tech? For somebody who's watching, what do you do?
A surgical scrub tech is the right hand of the surgeon. You'll be the one passing the instruments. You'll be doing everything they need you to do.
So you're very involved in the surgery. You're right in there.
Very involved. Your eyes need to be here. Your eyes need to be over there. You need to be listening, because they may ask you for 2 or 3 things and you gotta be able to prioritize what's important that they need first. First scrub of the day should be at least 3 to 5 minutes. And then I'll rinse off.
There's so many different things going on in an OR and so many people. Why is communication so important?
Communication is very important because if They ask you for something, it's for the patient, but if you're not paying attention and you give the wrong amount or to give the wrong instrument, you can cause harm. So you need to be listening, you need to double check and say, did you say so-and-so? The surgeon says yes, or if anesthesia says, I need help, and you as a scrub, you need to be ready to do whatever they ask you to do. 2, 4, 6, 8, 10, 12. I gotta count with my circulator before I put any instruments up, because everything's supposed to be done before the patient comes into a room. 2, 6.
How important is preparation for each surgery for you?
It's very important. I'm anal. I like having all my stuff. I need to know what I got, what I don't have. And if I'm missing something, I'll tell the surgeon before we get started, hey, I don't have this. What else can we use?
Tell me about just why this role is just so important.
Because you're changing a life, you're saving a life. Every surgery is important, every surgery is big. Whether it's small or huge, it's big to the patient, it's big to us.
And why do you love your job?
Because I see people come in a bad state, and what I do to help the surgeon make them much better, when they leave, they're in a better state.
Well, thanks so much, Angela, for showing us around.
You're welcome, my pleasure.
Hemostat, she's fast. Thank you so much for visiting St. Luke's today. Kansas City is such an exciting place to work and live, and we're so fortunate to care for such a great community. We hope to see you one day in the healthcare field, maybe even here at St. Luke's. There is no better place than right here.
This is St. Luke's, a healthcare system made up of diverse and dedicated professionals who unite for one vision: to provide the best care to our patients and communities. We position our team to achieve excellence. This is where we save lives, treat people with compassion, and fill hearts with hope. It's here where creativity meets technology, where diversity meets collaboration, where resilience meets community. It's all here at St. Luke's, the intersection of innovation and hope.
And joining us today live from St. Luke's are Brianna Frank, sterile processing technician, Angela Lewis-Thompson, surgical technician, and of course, Carrie Newberry, senior talent acquisition partner. Thank you so much for Brianna and Angela for joining us today. It was great to see you guys in the video and kind of explaining what you do, how you do it. I'll turn it over to you.
Hi, I'm going to get started. Hello and welcome. My name is Carrie Newberry, and I'm excited to share a bit about the important careers in healthcare, importantly, surgical technicians and sterile processing techs. I've been fortunate to work in healthcare recruitment for 20 years, and I work alongside 15 other healthcare recruiters responsible for keeping over 12,000 jobs filled at St. Luke's Health System. I have seen firsthand the many opportunities that we offer in healthcare. And as we mentioned in our video, it's not just about doctors and nursing. There are opportunities in nutrition, housekeeping, lab, clinics, and more. But today we're going to focus on sterile processing technicians and surgical technicians. As you've heard, surgical technicians are crucial in everything running smoothly in our operating rooms, also known as ORs. And at St. Luke's Hospital, that's one of our metro hospitals, that means supporting 10 ORs, 4 neurology ORs, and a cardiovascular OR. If you're interested in becoming a surgical technician, there are some community colleges that offer a 2-year associate's degree program. And from there, training can take 4 to 5 months in the hospital when you're hired. And at St. Luke's Hospital, surgical technicians start out at $24.50 an hour. The sterile processing technicians at our hospital in Kansas City provide clean instruments for our operating rooms. They also support 30 clinics, labor and delivery, in the Midwest Transplant Network. That's a lot of instruments. It takes a lot of employees to ensure that the safety and great care of our patients have come to expect. If you're interested in becoming a sterile processing technician, depending on the curriculum, the training can take anywhere from 15 to 18 weeks. And at a local community college here in Kansas City, the program is 16 weeks in the spring and the fall, and then they have an 8-week program in the summer. Once a sterile processing technician is hired at St. Luke's Hospital, the orientation typically is 12 weeks for someone that comes in without any experience. And at St. Luke's Hospital, a sterile processing technician starts out at $22 an hour. The participants from our video, surgical technician Angela Lewis-Thompson and sterile processing tech Brianna Frank, are joining me today. and I'm going to turn it over to them for their introductions.
Hello, I'm Angela Lewis Thompson. I'm a surgical scrub tech. I have been here at St. Luke's for 31 years.
Hi, I'm Brianna Frank, sterile processing tech here at St. Luke's, and I will be here a year in July.
So we're getting some questions coming in, but Brianna and Angela, I just can't imagine how you do what you do. It is so detail oriented. I get confused on which car keys I'm grabbing in the morning, and you're telling hemostat over this and what have you. So were you always that detail oriented, or is that something that developed through the job?
I've been pretty detail oriented most of my life. However, being in surgery was really detail oriented. You really have to pay attention. And it's not always where you can't have fun. You can have fun and you can make it so that you can memorize instruments a little better, and so the flow smooth is a smooth flow.
Mm-hmm. And for me, yeah, detail oriented. But for my job, a lot of it is, putting trays together, counting the instruments, making sure everything's there. I kind of think of that as a puzzle. And I've always loved puzzles growing up. So that's kind of how I look at it. So, yeah.
Just making sure every piece goes exactly where it needs to go, huh?
Exactly.
And the more you do it, the more you memorize it. Repetition is the key.
Is key. So we have a question coming through. Jasmine asked, how long does it take to become a surgical technician?
The program that they have right now at MCC, which is Metropolitan Community Colleges, you basically get an associate's degree, which is about 2 years. If you come in with out any experience, it's going to take you the full 2 years. With experience, doing your prereqs in advance, you can get through it in about 11 months. And once you come to the OR for the program itself, you're in training from February till June. It's about 6 months.
That's not bad. That's pretty quick, actually. Wow.
It's repetition and it's 8-hour days.
I think a lot of our young people could do that. I have faith. We do actually have, what's that?
Absolutely, they can do that.
So we do have a, Jen has a question and it's coming through right now. What's the most rewarding part of your job?
As a surgical scrub or
Both.
You go first. For me, it's changing lives. I mean, you can see patients come in a critical state, and you working with the surgeon and the team as itself, you see them transform into a new state. And so they're in a better shape than when they came in, and it's awesome. And then when they come back and say hi to you or thank you for helping them save their lives, you feel good. You feel really good.
Mine would probably be just, putting my best work out there, really, I like set personal goals, and so it's always my goal to have, 0 errors, to have all my trays be like perfect, no mistakes at all. And I mean, of course, that's the goal no matter what. But I mean, it's awesome when you reach that goal and you're able to put your best out there for the patients, because you would want that for yourself, you would want that for your family, and yeah, it's important.
Yeah, I know I've had a couple surgeries in my life, and every time I've gone into the OR, it's always been a very nerve-wracking time. Even though they're minor surgeries, breaking a leg or what have you, But I've always been amazed by just the professional decorum, as well as the kind of the fun, good nature that most of the OR rooms show. I always feel very at ease once I get in there and relaxed. And you guys are a big part of that. So thank you. We do have a young lady that's joining us from Facebook. Faith would like to ask, what made you want to do this career? Good question, Faith.
You want to go first?
Yeah. So my mom is actually a surgical tech, like Angela, and so that's my goal someday. Actually, I'm in school for that. But like it showed in the video, I said that I didn't know if I really wanted patient contact all the time. Like if you were a floor nurse, you would have, you know, a lot more contact with patients. So I wanted to be in healthcare. I just wasn't sure exactly where I wanted to be. And this was a great option for me to get my foot in the door. So I want to transfer anywhere else I can if I want to, you know, if I'm eligible or qualified, you know, but I really love what I do. So, yeah.
For me, I knew I always wanted to be in healthcare, but I wasn't exactly sure. I started out as a nurse assistant on the floors with the patients, and don't get me wrong, I loved working with patients one-on-one, but when I got to actually go into surgery and view a surgery and just shadow around, I knew that that's what I wanted to do. And I wholeheartedly say to any student, if you get an opportunity to shadow for surgery or just go in and follow a nurse, a doctor around for a day, you'll know if this is the job for you. You will know.
Well, I want to find out if this student wants to know as well. So we have a Phoenix who's going to go live. Phoenix, if you want to go ahead and unmute your camera, we'll go live. You can ask your question directly to Brianna or Angela.
What is the hardest part of your job?
Did you hear that?
Hardest part?
We're thinking.
The hardest part. Oh, that's hard.
Well, I got one. For sterile processing techs, so when you're at our hospital, at our location anyways, you may be assigned to a certain area, but there's always, you know, there's several areas where everyone works. And so you have to be able to multitask and prioritize what needs to be done first, what needs to be, you know, what's critical. And so you are constantly, you know, multitasking and kind of troubleshooting that and prioritizing, and things are always changing. So it's a fast-paced, you know, kind of work environment, but if you thrive in that, it's good. So
to piggyback off of what she said, multitasking can be very difficult. It can be time-consuming and long hours, long cases. If standing on your feet for more than 10 hours is not your thing, that might not be the job for you, because you are standing a long time. Sometimes you're in one position, sometimes you're in multiple positions, like playing twister, retractor. I mean, you can be doing more than one thing at a time and only have one hand to work with. So that can be pretty tasking on body. I would say that.
Great questions and great answers. We have time for one more question. We have Jabori who's going to go live. Jabori, do you have a question?
Yes, I do. Good morning.
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 What's something you wish you knew before going into the medical field?
Oh. I wish I knew.
I mean, this is just kind of general. When I was in high school and starting college and stuff, we didn't have these events. We didn't have a lot of information. So, I mean, really, when I graduated high school, the only medical field careers that I even knew about were nurses, CNAs, and doctors. And that was pretty much it. So, I mean, I just wish that, you know, I would have been able to maybe shadow some different careers. And I think that kind of would have given me more of a head start. So I just wish I knew about more options, I guess.
For me, being here 31 years, there were not a whole lot of options out there. So it was like basically trial and error. And I said, well, I want something in healthcare. Like I said, I started out as a nursing assistant in a hospital. I love working with the patients. However, it just wasn't something I wanted to do the rest of my life. And being a nurse is an awesome job, but that wasn't just for me. So getting the opportunity to really shadow and look at other areas in a hospital or healthcare setting was cool. So I was happy to have that opportunity.
Nice to meet you, by the way. You guys.
Oh, nice to meet you.
Great question and great answers. And, you know, I think I know I'm interested in surgical technologist or, you know, working in sterile processing.
Come on
My
down.
career is way on its way gone, but, you know, these young people here,
You're
they got
never
some
too old
opportunity.
to learn.
No, I
You're
still
never
have some
too
learning
old.
in me. Well, Brianna, Angela, we need to let you get back into the OR to save lives. And Carrie, thank you so much for joining us from St. Luke's. Thank you. Really appreciate it.
Thank you.
Thank you.
Bye.